Hi, I'm Dr. Singhania from Singhania Clinic, and I'm here to talk to you about my experience in pediatrics and my interests in the different aspects of pediatrics. I completed my medical school from Bombay University. Apart from getting a gold medal in my DCH and in my MD, I also ran a hospital in a 25-bedded and then later a 50-bedded hospital in India. As I was studying and working, I realized that I was very interested in the neurodevelopmental aspect of pediatrics. This deals with how children develop, what are the problems with developmental issues. So I went on to do my PhD in developmental medicine from University College London, Great Ormond Street. I was working with children since then, and I found that developmental work is multimodal in nature. The assessment, the treatments. Working in Dubai, I realized the paucity of help, particularly in those days. And so I did my MEd in Autism, which is a master's in education from Birmingham University, UK. And then I also trained in psychology and did my psych doc. The clinic has been operational for 20 years in Dubai. Apart from dealing with medical problems, which I do at the clinic as well as when in the hospitals have been attached to, I worked 10 years with the American Hospital, Dubai, and now the last 8 to 9 years I've been working at the Mediclinic City Hospital as a visiting consultant. But apart from medical problems, my special interest is in assessing and managing children with behavior problems. I do diagnose attention deficit spectrum disorders, the autistic spectrum disorders, learning problems, language, emotional. It's important to understand that neurodevelopmental disorders are impacted greatly by the environment. So whilst assessing the child, we need to get information not just from the parents but also from the child per se and from the schools they go to. Apart from getting information, you need to actually do an assessment. And unlike other medical issues where you have a single test, many of these tests don't have any neurobiological markers, which means if you have anemia, you do a blood test and you know you have a low hemoglobin. But for these tests, ADD, ASD, learning problems, you actually have to assess the child, and there are multiple ways to do it, and there is no black and white. So experience is really important. When we make a diagnosis, it should include the child's present abilities, achievement in different academic areas, the emotional status, the home and school environment. It's not just to label the child, it's to find out his strengths and weaknesses or her strengths and weaknesses and to work from there. It's also to find out how we can manipulate the environment both at home and school, how we have to microanalyze the problem so we deal with small issues. For example, a child with ADHD has allergies or recurrent ear infections. And we know that middle ear effusion can affect attention development. So you have to deal and treat the allergy and the middle ear infection. So the managing is not just giving medication, but it's also remedial training. The child has difficulties with reading, writing, math, with language and communication problems. Because especially children who are on the autistic spectrum may be talking or may have adequate words, but may not be able to use them to communicate. And there are other ways to improve attention, study skills, parent effectiveness training. I also help school to set up behavior management programs. If you're seeking help, please book an appointment at Singhania Clinic by calling 04-4298-498 or email us at reception@singhaniaclinic.ae. Thank you for watching.